endocrinology used to be based on symptoms. So you have to be a really good clinician. And the bad thing, those symptoms can be very non-specific. And there's a lot of crossover between hypothyroidism, hypogonadism, hypoparathyroidism, hypocortisolism. A lot of cross symptoms. So the way endocrinology used to be before they had all the blood tests, if you make, the patient comes to you, has those symptoms, you generate a differential diagnosis. And then if you think, oh, it could be thyroid, you give him thyroid and you do a therapeutic trial. You follow up, 3 months later, are you better? You better? It was thyroid. If it's not better, it's something else. So we went from a patient-centered, symptom-centered diagnosis to now a numbers diagnosis. So endocrinologists will tell you now they're using 264 as their lowest number. So a patient will come to them with all the symptoms of low T, including insulin resistant, dysthymia, depression, ED. And I had that patient the other day, his number was 278, and they told him he was fine. And they wanted to put him on an SSRI, on a depression medication.